I hope everyone can hear me. Happy Friday, finally. God, it just seems like every week is starting to drag now. So my name is Rob Light, and I'm a benefit marketing rep, and I work with Sarah. Both Sarah and I work with the SEBB program specifically. Then we have Larry and Jamie that work with the PEB program as well as Deb, who's a new member on our team. So I know you all are getting a lot of new benefit administrators that are coming and going in your SEB orgs. If you do need additional training for those new benefit administrators, please send us a fuse and we will set up a meeting to get with you and be able to train those new benefit administrators. All right, here we go. So welcome to the 2022 pre-annual open enrollment for SEB. So I did send out all the a copy of the slides to everyone. I hope everyone got it. If you did register after I sent those out, just send us a question saying that you need a copy of the slides and we'll get those out to you. So what are we going to talk about today? So we're going to talk about the 2022 annual open enrollment and what employees can do, what they can't do, and then what resources are available to those employees to do the research and pick the plans that are right for them. We're also going to talk about the new 2022 premiums and the benefit changes that are going on for 2022. We're also going to cover the 2022 medical FSA and DCAP, and then any changes that are with the FSA program. We're going to discuss some new program rule changes, and we're going to talk about SEBB My Account, things you can do in SEBB My Account during annual open enrollment, and then things you can't do in SEBB My Account. And then finally, we're going to provide you with some contact information. If your employees do have questions, who to contact with those questions. And then, as usual, we're going to provide you with some reminders, tips, and resources.
Real quick, Rob, I just want to say, if you need a copy of the slides, please let me know and also include your email address so we know who we're emailing it to. That would be much appreciated. Thank you.
All right, I feel the sun coming out. I'm staring straight at the window here, so I could feel the sun. It's going to be a great day. I think it's supposed to be sunny today and tomorrow, I believe. Who knows? So if you don't know by now, annual open enrollment is starting October 25th through midnight of November 22nd, 2021. And if there are any new elections, those will be effective January 1st of 2022. So your employees do have till midnight of November 22nd to make any changes to their health plans. Here's a few important dates here. On September 24th, which was last Friday, the SEBB open enrollment information is now available on the open enrollment webpage. If you haven't already, start directing your employees to review some of that information on there. The SEBB virtual benefit fair and Ask Alex will also be available 24 hours a day. It was updated last Friday. And again, your employees can go and use those resources 24 hours, 7 days a week. On October 12th, the October SEBB Intercom newsletter will be mailed and emailed to those employees who subscribe to the email subscription, and it'll be mailed also. And then on October 19th, the SEBB spousal surcharge letters will be mailed to those employees who may have to reattest to the premium surcharge. And then on October 22nd, the SEBB dual enrollment letters will be mailed to those employees who are dual enrolled in both the SEBB and the PEB program. And we'll talk later about dual enrollment later in the slide deck. And then finally, on October 25th, the 2022 SEBB forms will be posted online. So the Healthcare Authority is hosting a Facebook Live event for your school employees, and they can learn more about the plan changes that are happening for 2022. They can get answers and more. All they have to do is log on to the Healthcare Authority's Facebook page on November 2nd of 2021 at 4 p.m. The SEBB program will also be providing email messages to forward to your employees, and these are done through GovDelivery before open enrollment and throughout the open enrollment period. Again, you must be registered in GovDelivery to receive these email messages. And how do you register for GovDelivery? You can do that on the Benefit Administrator's webpage under Notices and Updates. Just click on the black button that says Register for GovDelivery. So employees can also find additional information in that October edition of the SEB Intercom newsletter. Again, that's going to be mailed out on October 12th to all school employees. And this is the only 2022 open enrollment notice to school employees. There's additional information again on the SEB program open enrollment webpage, and that was updated on last Friday, September 24th. So the SEB employee enrollment guide will also be posted online, and it's available upon request when you order it on November 19th. So keep in mind that this enrollment guide is intended for newly eligible school employees that are enrolling for 2022. So we've been getting a lot of questions, when are the new enrollment guides coming out? These shouldn't be for your current employees. They should be going online using the virtual benefit fair and SEB My Account to make their elections. These should be for newly eligible school employees that are enrolling into SEB benefits for 2022. Again, you can order these materials on the BA website under forums and publications. All right, so due to the COVID-19 pandemic, the Healthcare Authority will not be offering in-person benefit fairs again this year. Due to the pandemic is still going on. So we do have the virtual benefit fair that we're offering as a resource for your employees to research and select their plans. So this is a copy of the employee and retirees benefit webpage. And as you notice in the middle, currently your employees are finding their information under school employees in the blue column in the center. And when they retire, they'll look to the right corner there where it says retirees, and that's where they'll find their information. But for open enrollment, once they go to the employee and retiree benefit webpage, they can click on open enrollment at the very top, one of the hot links, and that'll bring them to this page here. So they'll be able to get all their benefit information, plan changes, what benefit changes are happening for 2022, the different premiums, and they can also get a schedule of all the webinars that the carriers are going to be having during open enrollment. And if they didn't receive a copy of the October newsletter, they can find that here under newsletters for SEB. And to access the virtual benefit fair, just click on the virtual benefit link right there on the lower part on the left. So the virtual benefit fair provides benefit options and plan availability, plan comparisons, upcoming webinars, and video links. It also has downloadable content, and you can access this using your computer, tablet, or smartphone. That's a great thing. Again, this website was just updated last Friday with all the current information for 2022. And if you got a copy of the slides, I've inserted all the links on the very bottom of each slide.
And I just want to point out really quick, for those of you who requested a copy of the slides, I will get those to you after the webinar today. I need to get the PDF version from Rob. So you'll be receiving those to the email address that you provided me after today's webinar.
So Alex, which is our interactive online benefit advisor, helps employees understand their benefits. It also guides those employees through the decision-making process so they can select the plan that's right for them. It'll suggest available health plans that are available to those employees, and this information was updated last Friday. So Alex will be available 24 hours a day, 7 days a week, all year round. So if you have new employees that are coming on board throughout the year, they can also use Alex as a tool. So what can employees do during open enrollment? So first of all, employees are not required to make any changes to their health plan. And when I say health plan, I'm talking about medical, dental, vision plans, unless their health plan is no longer available in their service area, or unless they're dual enrolled in both SEB and PEB programs. So employees who do not make any changes will remain enrolled in their current health plans for 2022. So employees covering a spouse or state registered domestic partner on their 2022 medical coverage may have to reattest to this premium surcharge. Employees who choose to participate in the medical FSA or DCAP program, again, they must re-enroll or enroll if it's the first time every year. This doesn't continue from year to year. You must enroll or re-enroll every year. And you notice the important change on the bottom there, dual enrollment and the employee paid LTD changes are coming effective January 1, 2022. And we'll talk about more about dual enrollment in that section and the employee paid LTD. So what else can employees do during open enrollment? Well, they can change their medical, dental, vision plans. They can also add and remove dependents from their medical, dental, vision plans. So if they're adding or enrolling a dependent, again, they must have that dependent verification documents. And there's a list of acceptable documents that are available on the VA website under rules and policies. And the policy that covers it is 31-1. They can also waive medical coverage if enrolled in other employer-based group medical, a TRICARE plan, or Medicare. They can also waive medical coverage if they're dual enrolled in PEB medical, only if they're enrolled in PEB dental. So employees also waive enrollment in SEBB dental and vision if they do this. So employees may also enroll in medical coverage if they previously waived that medical coverage. Does not require proof of other coverage. They can also change their employee paid LTD elections. They can remain in the enrolled at the default at 60% employee paid coverage plan, or they can reduce to the 50%, or they can decline the employee paid LTD coverage altogether. If they don't do anything at all, they will remain in the 60% employee paid coverage plan. So they can either choose the PEB or SEBB program for their medical, dental, vision plans if dual enrolled. They must waive enrollment in the other plan. So what changes can they make all year round? Well, they could change at any time their supplemental life and AD&D to include their employee paid LTD, which I just discussed. Evidence of insurability and the insurance carrier approval may be required. They can also subscribe to receive SEBB program emails. All they have to do is log into SEBB My Account, enter their email address, and then click on Covered Summary and check the box saying that you wish to receive email notifications from the SEBB program. All right, let's jump into the medical plans, which are effective January 1, 2022. So this is a list. We're going to start with the Kaiser Permanente plans here. As you notice, the base rate has remained the same at $968. And under employee or single subscriber for 2021, it was $39. And now for 2022, it's $50. So as you notice, everything highlighted in purple, the rates have slightly increased, which is pretty much everything on this page here. Again, the base rate is due to the healthcare authority, even if the employee chooses to waive their medical coverage. And you can find the base rate information on the VA website under the fall rate letter for 2022. And these are the plans for Premier Blue Cross. As you notice, their high PPO plan last year in 2021, it was $76 per month. Now it's $87 per month for 2022. And then for the uniform medical plan, the Achieve One, which is also our default plan, in 2021, it was $33 a month for premiums. And now in 2022, it increased to $37 a month. The only plan that has remained the same is the high deductible plan. There are no changes if you are going to enroll in a high deductible health plan from last year to 2022. All right, let's jump into the health savings account. Let's see what's changed in that area with changes effective January 1, 2022. So for the employer contribution, it remains the same. The healthcare authority for individual accounts, they'll deposit $31.25 per month into your health savings account if you enroll into a high deductible health plan. And for one or more family members, they'll deposit $62.50 per month into your health savings account. There is no change when it comes to the employer contribution. So for the employee contribution, this is the IRS maximum amounts for 2022. It's increased from $3,600 to $3,650. So you had that $50 increase for a single contribution amount. And for a family contribution amount, it has increased $100 from $7,200 to $7,300. And keep in mind, for those employees that are age 55 or older, they can contribute an additional $1,000 per year into their HSA account. All you have to do is submit the school employee's authorization for payroll deduction and health savings account form to your benefit office. So just as a reminder, all contributions and the Smart Health Wellness Incentive, if earned, may not exceed the IRS maximum. So employees who enroll in a UMP high deductible will now have access to a new benefit. It's called the Limited Purpose FSA. So this was intended for those employees who are enrolling in a high deductible health plan. So in this new program here, you can set aside pre-tax funds for dental and vision expenses only, which allows you to use your HSA funds for your medical expenses. So you can choose to set aside a minimum of $120 and a maximum of $2,750 for 2022. So this is the IRS Notice 2019-45, which expands the list of preventive care benefits the UMP high deductible plan can cover before a member meets their deductible. All right, let's jump into the individual medical plans and what changes are happening, starting with Kaiser Permanente, Northwest, Washington, and Washington Options, with an effective date of January 1st, 2022. So the first benefit change for Kaiser Northwest is that naturopathy benefits. The visits will be covered now under the primary care. They're no longer covered under specialty care. And you're subject to a primary care copay. There's no visit limits, no dollar max per plan year, and they're changing to self-referred only. For rehabilitation services that allow self-referrals, no longer requires that prior authorization. For outpatients, physical, speech, and occupational therapies, we'll have a combined visits of 60 visits per plan year. They're also subject to specialty care copay. For acupuncture benefit, they're adding self-referrals. For physician-referred visits, it's unlimited. For self-referred visits, you have 20 visits per year. And for the massage benefit, self-referrals are now allowed, no dollar limit maximum. You do have 20 visits per year with a copay of $25 per visit. For dental services for potential transplant recipients, referral is required for a covered transplant evaluation. Services are authorized by the National Transplant Team Services. And what this team does, they approve transplants for such as kidney, liver, bone marrow. Coverage adds routine dental services necessary to ensure that the member is clear of infection prior to being placed on the transplant wait list. For insulin, the out-of-pocket maximum cap for each insulin prescription filled is now $75. It came down from $100 last year. It does not require or does not change the drug tier or related tier costs. Members paying an amount less than $75 will continue to pay the lower amount, cost share. There is a new in-network provider, Peace Health Southwest Medical Center. They were added to the Kaiser Northwest plan. So now we're going to jump into the Kaiser Permanente, Washington, and Washington Options benefit changes, effective January 1, 2022. So they are adding in-home infusion therapy through their network providers. There's no cost shares for administration of infused medication for an in-home setting. Cost shares are required for prescription drug costs. The out-of-network providers are no longer covered under the Kaiser Permanente Washington Option Access PPO plans. The urine drug screening, they're now covering 2 urine drug screenings in full per year. You are not subject to the annual deductible. They're removing the cost shares, 0 copay per plan year, and it includes urine drug screening for employment. They're also removing the annual out-of-network maximum pocket or out-of-pocket limit for the Access PPO 1, 2, and 3 plans. And then the network status of several large providers is changing. The removal of Kittitas Valley Medical Center as an in-network provider is being removed. And then Kaiser Permanente Washington option members will have out-of-network coverage only. The removal of Multi-Care Health System as an HMO network for the Spokane area. And this will affect members enrolled in the Kaiser Permanente HMO plans. Please confirm your network provider status with the Kaiser Permanente Washington plans at 888-901-4636. For the service area for Kaiser Permanente, they're also removing Kittitas County. It's no longer available to employees. So employees who do not make a plan change during open enrollment will automatically be defaulted to the UMP Achieve 1 plan, which is our default plan. So let's jump into Premier Blue Cross plan changes effective January 1, 2022. They're adding a Quit for Life tobacco cessation program. There's no cost to members. It's unlimited phone coaching. They're adding Kittitas County to the Premier High PPO and standard PPO service areas. Please contact Premier at 1-800-807-3710 for any questions. And this is the service area for Premier Blue Cross. All right, let's jump into the uniform medical plan changes for an effective date of January 1st, 2022. So for UMP accumulators, when an employee enrolls in a UMP plan, changes enrollment to another UMP plan during a special open enrollment only, not including open enrollment, the amounts accrued towards accumulators will now transfer over to the new UMP plan. For mental health parity, it ensures compliance with the federal parity laws for mental health substance use disorder benefits, medical and surgical benefits. It removes coinsurance for mental health and substance use disorder, inpatient professional services. There is no change to the UMP high deductible health plan. No coinsurance for these services. For continuous glucose monitors, it's now paid under the pharmacy benefit, no longer paid under the medical benefit. Members currently receiving continuous glucose monitors through the medical benefit will be required a prescription from their provider to receive them through their network pharmacy. Chiropractic, acupuncture, and massage. The UMP plan, we're not talking about the UMP high deductible members. So the UMP plans, members pay the copay even if they have not met their deductible. For those that are in the UMP high deductible, members must meet their deductible first before the copay applies. Once the out-of-pocket maximum is reached, members' copay no longer applies and the plan will pay 100%. So for all chiropractic, acupuncture, and massage, you will have 24 visits per year with $15 copay per visit. Keep in mind that the massage is an in-network only benefit. For UMP members who are dependents of an employed state registered domestic partner, Medicare will be primary. And for those members that are 65 and older, Medicare will be secondary. For the UMP Plus plan, Puget Sound High Value Network, they are removing Thurston County as of January 1st, 2022. The UW Medicine Accountable Care Network will still be available in Thurston County. Multiple notices will be sent out to those affected members from the Healthcare Authority and the UMP plan. Members who do not make a plan change during open enrollment will be defaulted to the UMP Achieve 1 plan. Keep in mind that there are other plans available in the Thurston County. And that's the service areas for the UMP Plus plans. All right, let's jump into the premium surcharges for 2022, effective January 1, 2022. We still have the tobacco use premium surcharge and the spouse or state registered domestic partner premium surcharge. So for the tobacco use premium surcharge, you can attest or reattest if applicable. Tobacco use premium surcharge will remain at $25 per account per month in addition to their monthly medical premiums, regardless of the number of family members that use tobacco that are enrolled on your account. You can attest anytime throughout the year. But remember, no need to reattest unless there's a change in your tobacco use status. So for the spouse or state registered domestic partner premium surcharge, it'll remain at $50 per month in addition to the monthly medical premiums. So employees may have to reattest for this premium during open enrollment. Again, those letters will be sent out on October 19th to those employees who need to reattest. Employees can also check to see if they are required to reattest using SEBB My Account starting October 25th. They can log into SEBB My Account, just click on premium surcharge attestations and follow the instructions. So there is a change to the SEBB premium surcharge attestation help sheet. So question number 6 will now read, will your spouses or state registered domestic partners share of their medical premiums through their employer be less than $114.01 per month in 2022? So that's an increase from $109.26 from last year. So how do employees reattest? So they can do that during open enrollment in SEBB My Account, which we prefer, or they can also submit a paper form to their benefit office. So we always prefer that employees use SEBB My Account to make any changes, and that'll save a lot of work for you benefit administrators from having to go in and manually enter their forms into SEBB My Account. And they can also reattest during the change period, November 23rd to December 31st. During this period, they must submit the premium surcharge attestation change form to their benefit office. And again, that surcharge does not apply if you're waiving the SEBB medical coverage. Employees who do not reattest between October 25th and the end of December will default to incur the $50 premium surcharge, which will remain in effect for the entire year of 2022, unless you have an SOE event that changes your attestation. So for the SEBB dental plans, keep in mind that eligible school employees pay no monthly premiums for their dental insurance benefits. You'll have the same dental plans that will be available for 2022. You have the Uniform Dental Plan, Dental Care, and Willamette Dental Group. There are no changes to the dental benefits for 2022. Please call the plan directly to verify which network your dentist participates in. Don't ask your dentist. So Delta Dental or Delta Care and Willamette Dental Group are both managed care plans. You must choose a primary dental provider within the network. The plans will not pay for claims for providers outside of their network. So they are a managed care plan. compared to the uniform dental plan is a PPO plan. You may choose any dental provider, and it's probably going to be a lower out-of-pocket cost for network providers. Delta Dental of Washington administers both Delta Care and the uniform dental plan. So keep in mind, Delta Care is a managed care plan, and then your uniform dental plan is a PPO plan. So we get a lot of appeals after open enrollment. I meant to select uniform dental plan instead of dental care. So for some reason, the Delta Dental of Washington kind of confuses people because it has Delta and it has dental. So that kind of confuses people, and they end up selecting Delta Care, which they didn't want. So they end up submitting an appeal. So one is a managed care plan, the other one is a PPO plan. So the network of providers are different. Please call the plan. Have your employees call the plan. Don't ask their dentist if they participate in that network. So let's jump into the 2022 SEBB vision plans. Same rule applies. Eligible school employees pay no monthly premiums for their vision insurance benefits. Same vision plans will be available to your employees for 2022, Davis Vision, iMed Vision Care, and MetLife Vision. There are no changes to the vision benefits for 2022. So for life and accidental death and dismemberment insurance, same rule. Eligible employees pay no monthly premiums for the basic life and AD&D insurance benefit. So for supplemental life and AD&D insurance rates will remain the same for 2022, unless the employee changes age bracket or increases their coverage. Life insurance rates increase becomes effective January the following year. So if you have an employee that changes age, they become 50 in March, their rates will not change until January of the following year, regardless when their birthday is throughout the year. Just as a reminder that employees can log in to view their current coverages and update their beneficiaries. So I know a long time ago, we did have a lot of employees that didn't have beneficiaries on their life insurance. So please remind your employees to go in and make sure that they have beneficiaries designated for their life insurance. You can always submit a group term life insurance beneficiary designation form to MetLife. All right, let's jump into the long-term disability. So what's new for 2022 plan year with changes effective January 1st? So this is the big change. So there was a language update. Previously, it was referred to as basic long-term disability. It's now called employer-paid long-term disability. So don't confuse this with the life and AD&D. It's still called basic life and AD&D for the employer-paid when the employee pays that. So previously referred to as supplemental long-term disability, the language has changed to employee-paid LTD. So let's talk about what's not changing first. So your employer-paid LTD coverage is not changing. You still have a minimum benefit of $100 per month, a maximum benefit of $400 per month. You still have the same benefit waiting period. Nothing's changed with your employer-paid LTD coverage. And keep in mind that employees cannot waive their employer-paid LTD coverage and does not require evidence of insurability. All eligible school employees will be offered 3 options for the employee-paid LTD coverage. So this is really important that your employees go into SEBB My Account and make an election. So they'll be offered the 60% employee paid coverage plan, the 50% employee paid coverage plan, or they can decline the employee paid coverage plan altogether. So school employees who do decline, they will remain on the employer paid LTD coverage. So here are the new rates here for the LTD. As you know, notice the current rates at 60%. And then the new rate at 60% benefit, which is our default rate, it slightly decreased a lot and even decreased even more under the 50% benefit. So employees, if they don't do anything at all in SEBB My Account, they will be defaulted to the 60% and they will pay that rate until they go in and decline. So every employee, every eligible employee will be defaulted to the 60% until they go in and either select 50%, buy down, or they decline the employer paid LTD. So at the beginning of annual open enrollment, all eligible school employees not currently enrolled in the employee paid LTD will be auto enrolled in the 60% coverage plan. There is no EOI required, and the effective date of coverage will be January 1st of 2022. So for those employees that are currently enrolled in the employee paid LTD, they will remain enrolled in the 60% coverage plan. So long-term disability is not offered to those school employees that are engaging in local negotiations with our CBA. So during open enrollment, all the way until December 31st, all eligible school employees must choose to either remain enrolled in the 60% coverage plan, elect the 50% coverage plan, or decline the employee paid coverage plan altogether, with changes effective January 1st. So how do employees make their elections? During open enrollment, they can do that in SEBB My Account, which is the preferred method, or they could submit an LTD enrollment form to their benefit administrators. During the change period from November 23rd to December 31st, the employee must submit an LTD enrollment change form to their benefit administrators. SEBB My Account will be, the open enrollment banner will be closed. All right, so what happens if an employee does nothing at all as of December 31st, 2021? So if they don't do anything, and we know there are some employees that don't go and SEBB My Account, they're happy with their elections, and they just stay in there. Highly advise that all employees just go into SEBB My Account and confirm that the elections that they want are still in there. And definitely look at the LTD, because you're automatically defaulted. So if you don't do nothing at all, you're going to be paying for that 60% employee paid LTD coverage. So if they don't do anything at all, they will remain enrolled in the 60% coverage plan. They can decline coverage with an effective date of the first of the following month, or they can elect the 50% employee paid coverage plan. After open enrollment, those employees can reduce or decline their coverage by submitting that long-term disability enrollment change form to their benefit administrators. So starting January 1st of 2022, all newly eligible school employees will be automatically enrolled in the 60% coverage plan. Within that initial 31-day eligibility window, they must make an election either reducing or declining coverage. If not, they will remain in that 60% coverage plan. EOI is not required for auto enroll or electing 50% within the 31-day election window. If no action is required if they want to remain in that 60% coverage plan. They can also enroll in the 50% coverage plan, or they can decline the employee paid LTD coverage. Also, newly eligible employees who did not do anything during their initial 31-day eligibility window will remain enrolled in the 60% coverage plan. Later on, anytime throughout the year, they can decline coverage with effect of the first of the following month, or they can elect the 50% buy down. After the 31 days, newly eligible employees must submit that long-term disability change form to their benefit administrator. The evidence of insurability may be required after that 31 days. Employees may elect to reduce employee paid to 50% coverage plan without an EOI, or fully decline employee paid LTD at any time throughout the year. Employees who increase coverage from 50 to 60% or access previously declined employee paid LTD will be subject to the EOI. And again, that effective date will be the day of the month the contracted vendor approves the required form. So if you decline coverage and later on you want to enroll into the employee paid LTD during the year, you will be required evidence of insurability. So how do you enroll in SEBB My Account? Under the supplemental coverage tab, you'll have 3 choices there. Automatically, that blue dot will show up as employee paid 60% default plan that's selected for all employees as of October 25th. So all your employee does, if they want to decline, they can go down to opt out, click that round circle there, and then hit the submit button. If they don't do anything at all, they will remain in the 60% default plan, and they will pay the premiums for that until they decide to decline during the year. So outreach and training will be producing or recording and posting a LTD recording on the BA website under training materials, open enrollment. We will have this posted prior to October 25th, open enrollment. The standard is also hosting webinars during open enrollment period. You must go on the open enrollment webpage for SEBB and register for these webinars. Those are the dates and times that they're going to be providing their webinars. All you have to do is click on the long-term disability on the left-hand side, and then down in the center of the web page, you'll see the schedule that's on the screen there for upcoming webinars, and just click on to register. All right, let's take a 5-minute break, Sarah.
All
Take a
right,
quick
sounds good.
stretch break.
Yeah, so let's come back at 10:54. I'm gonna continue to try to answer some questions. We have a lot of questions, so I'm gonna continue to work through this as we take our break. So we'll see you here in 5 minutes.
Sarah, are we ready to pick back up?
Yes, so welcome back. We're going to continue on to the second half of today's presentation.
I've been trying to help you answer those questions. There are a lot of questions.
There are. So bear with me, everyone. Like I said, if I'm not able to get them answered, some I might not know the full answer to. So I want to look into, maybe that's why it hasn't gotten answered. But I will be following up with you early next week to get those answered on an individual basis for you.
And I noticed there are a lot of questions about the new employee paid LTD that employees will automatically be defaulted. And if they do nothing at all, they'll be paying that monthly premium. That decision was approved by the SEBB board. So all I can say is just make sure your employees go in there. And if they don't want employee paid LTD, make sure they click on to opt out or decline the employee paid. Or if they don't do anything, again, they will be charged.
Yeah, and I do
And I
want to
know
point one more thing out. So even if an employee is currently declined in the supplemental LTD coverage that is currently available, if they have opted out or declined that coverage, with this change, they are going to be automatically defaulted into that 60% plan. So it's really important that all existing employees are aware of this, and they're going to receive that newsletter with that change letting them know, but they need to take action in SEBB My account or via the form to, if they're not wanting to be defaulted into that 60% plan.
All right, let's get back into it, try to finish this up before the hour and a half is over. So now we're going to jump into the medical flexible spending arrangement and the DCAP program. What changes are there for those effective January 1st, 2022? So for the medical FSA, the minimum has decreased. So for last year it was $240. Now this year for 2022, it's $120. And the maximum has remained the same at $27.50. For the Dependent Care Assistance Program, it has remained the same. There are no changes. It's still $5,000 annually for a single person or married couple filing a joint income tax return, or $2,500 annually for each married participant filing separately. SEBB eligible employees may enroll or re-enroll every year in a medical FSA or DCAP during annual open enrollment to participate. If they don't do anything, they will be removed or not re-enrolled into that program. So they must, if they want to still keep their FSA, they got to re-enroll in it. And that's done every year during annual open enrollment. Even if the contribution amounts remain the same, again, this doesn't continue on year to year. SEBB eligible employees may not enroll in a medical FSA and a UMP high deductible health plan, health savings account at the same time. Nothing's changed about that. An employee who does do that will be disenrolled from the medical FSA as of December 31st and will remain enrolled in the high deductible health plan with a health savings account. Employees may not enroll or re-enroll in a medical FSA if the employee or the spouse is enrolled in the high deductible health plan for 2022. They can still enroll in the DCAP program. So current members do have deadlines when it comes to the medical FSA. The medical FSA expenses may be incurred through March 15, 2022. They must submit all claims for reimbursement by March 31st. So for this year, going into 2022, you still have that 2.5-month grace period. Funds not claimed by March 31st cannot be refunded, and those unused balances will be forfeited. Employees will not be able to claim forfeited funds. So there's no end of the year unused funds that'll carry over into 2022. So in 2022 plan year, any unused funds up to $550 will carry over into 2023. So again, anything over $550, you will lose. So you do have a minimum of $120. So you must enroll in the 2023 plan or have the minimum $120 left in your 2022 FSA account to have that carried over. So there is an exception for the March 2022 deadline. This does not apply to an employee that has a medical FSA in 2021 and enrolls in a UMP high deductible health plan with a health savings account in 2022. If they do that, employees must use all of their 2021 medical FSA funds and have all claims paid by December 31st. If not, the employer nor the employee cannot contribute to the health savings account until September 1st, or correction, April 1st of 2022. So for the DCAP deadlines, current members do have deadlines. There is a special allowance for the 2021 DCAP enrollees. As a result of the COVID-19 pandemic, the SEBB program is allowing employees an extra 12 months to spend their 2021 DCAP funds. Employees enrolled in a DCAP for 2021 and have funds remaining can keep incurring those expenses during 2022 plan year. They can submit claims all the way through December 31st of 2022. The unused balances will not be forfeited to the plan administrator on December 31st of this year. So they can continue to use those funds, those DCAP funds, for an additional 12 months. So what changes are there with the FSA for 2022? So currently members have a medical FSA and they have the DCAP program. So for 2022, they are now introducing the limited purpose flexible spending arrangement. So what is the limited purpose flexible spending arrangement? It's a personal expense account that works with your health savings account, allowing you to set aside pre-tax dollars to pay for eligible dental and vision expenses only, and available to eligible employees who are enrolled in a high deductible health plan with an HSA. So the limited purpose FSA is intended for employees enrolled in a uniform medical plan, high deductible health plan with an HSA. It's pre-funded just like your medical FSA, and the amounts are available anytime, regardless of the amount that you have contributed. Compared to the DCAP, it's only available as you contribute the amount in to your account. It's the same as a medical FSA, minimum and maximum of $120 minimum and $27.50 maximum contribution limit. So you can't have both a medical FSA and a limited purpose FSA. Employees can use their HSA funds for healthcare expenses. So again, those unused funds up to $550 can be carried over and made available to those employees for 2023 plan year. There's no more grace period going into 2023. It's a new carryover feature. So again, anything over $550, they will lose. And there is a minimum that you got to at least have $120 in your account to be carried over. So to receive this carryover, the employee must enroll in the 2023 plan year or have a minimum of $120 left in their 2022 FSA account. So the carryover applies again to the medical FSA and the limited purpose FSA. It does not apply to the DCAP program. But you do have that 12-month extension with the DCAP going into 2022 due to COVID. So how does the carryover work? So it replaces that 2.5-month grace period that you currently have. The only difference is that your last day to incur services will be December 31st of next year, 2022. And you must submit reimbursement claims. So the last day to submit will be again 31st. That hasn't changed. It's still the 31st of March. So the last day to incur your services currently was March 15th. Now you must incur those services prior to December 31st, 2022. So employees who enrolled in a high deductible health plan with a HSA in 2023 will still be eligible to receive the carryover. So leftover funds from your medical FSA will be converted over to your limited purpose FSA. There's no action required from the employee. Unlike the medical FSA, employees can participate in the limited purpose FSA with the HSA in the same plan year. So again, it is limited on your benefits with the limited purpose FSA. Employees who enroll in a high deductible health plan with the HSA for 2023 cannot enroll in a medical FSA. So here's a list. If you notice the list under limited purpose, It's not as long as the list in the medical FSA. So you do only have dental and vision benefits for the limited purpose. So if you're in a traditional plan, you may want to go with the medical FSA as you have more benefits. Now, if you're this limited purpose was intended for those that are enrolled in the UMP high deductible health plan. So all of 2021 medical FSA will be subject to the 2.5 grace period currently going into 2022. So this fall, participants who enroll in the 2022 FSA are subject to the carryover, not a grace period going into 2023. The first carryover will happen January 2023. So you do have a couple enrollment options. SEBB eligible school employees have 3 enrollment options. During their initial eligibility, they have no later than 31 days, or during the SEBB program annual open enrollment that we're getting ready to approach here. And then if you have a special open enrollment event, you have no later than 60 days. Employees may edit or remove their elections through the end of the SEBB annual open enrollment on November 22nd. So we are conducting another webinar on Friday, October 22nd from 10 a.m. to 11 a.m. So this will be hosted by Outreach and Training, and it'll be presented by the Navia Benefit Solution employees. So be sure to go on the BA website and register for our next webinar on October 22nd. And again, this webinar will be recorded and also posted on the BA website once it's complete. Navia will also be hosting webinars during open enrollment to learn more about the limited purpose FSA. You must register on the open enrollment webpage under medical FSA. Those are the dates and times that they'll be conducting those webinars. So when it comes to Smart Health, you still have the $125 Smart Health incentive, which will remain the same for 2022. The deadlines for completing the financial incentive requirements are the same for those employees that are enrolling between January and September 2022. Their deadline is November 30th of 2022. For those that are enrolling between October and December of 2022, their deadline will be the end of December. So there are a few rule changes when it comes to newly married, and then the cross-program dual enrollment rules effective January 1, 2022. Eligible school employees who wish to enroll a newly married or state-registered domestic partner will now not have to provide evidence that the marriage is still valid. So what we mean by newly is within the last 6 months. So here's an example. So you have a newly hired employee married within the last 6 months wishes to enroll their spouse in their account. So they will now only require to provide the marriage certificate. No evidence that the marriage is still valid is required, such as that utility bill with both people's name on it or a bank statement. And again, newly means they were newly married within the last 6 months. I know we had a lot about that in the last year where I don't have a bank statement, I don't have a utility, you know, we're living in separate places and so on. So now within the last 6 months, all they have to do is provide their marriage certificate if they're married within the last 6 months. So now we're going to jump into the new cross-program dual enrollment rules. So what's changing? Starting January 1st of 2022, employees will no longer be able to dual enrollment across PEB or SEBB programs. It'll be prohibited for employees and their dependents. So what is dual enrollment? An employee or dependent is dual enrolled if they are enrolled in medical, dental, vision coverage under both the SEBB and PEB programs, or coverage under 2 accounts in either program. So these are just a couple examples here. Maybe a SEBB employee and they're also a PEB employee. Eligible school employees must elect benefits for themselves and their eligible dependents in only one program. If you're in the SEB program, you're limited to single enrollment in medical, dental, vision. Or if you elect the PEP program, you're limited to a single enrollment in medical and dental. So vision is included in your medical plan with the PEP program. Changes will be effective January 1st of 2022. So letters, again, will be going out to those employees that are dual enrolled in both programs, or if their dependents are dual enrolled in both programs. So it's the employee's responsibility during annual open enrollment. They must choose either the PEP program or the SEB program for their medical, dental, vision plans. They could take no action at all to remain enrolled in the program of their choice, or they can enroll in one program of their choice using SEB My Account or submitting the employee enrollment change form for PEB. And they must also waive enrollment in the other program that they're not choosing. You can do that in SEB My Account or PEB My Account. But you can't be enrolled in both the SEB program and the PEB program, effective 1 January 2022. School employees who do not resolve their dual enrollment by the end of annual open enrollment, which is the midnight, November 22nd, 2021, may be auto-enrolled along with their dependents into one program and auto-disenrolled along with their dependents from the other program. You can always watch the dual enrollment rules recording posted on the BA website under training materials. We hope we will have this posted by the beginning of open enrollment, October 25th. So for the employer actions, we ask that you communicate to your employees how to resolve dual enrollments during the open enrollment period. And SEB dual enrollment letters will be mailed out to those employees that are dual enrolled on October 22nd. And they'll also be sending reminder letters to those employees that are dual enrolled on November 8th, reminding them that they need to take action. So also communicate those consequences when no action is taken by the employee to resolve their dual enrollment by November 22nd. Communicate to your employees to follow the instructions on the appeals form that's sent by the SEB program. If they take no action at all, they'll automatically be enrolled in a program that they didn't choose. So they'll probably want to appeal. So just communicate that they need to follow the instructions on the appeals form. That list of impacted employees and dependents will be available in SEB My Account starting October 25th, and you can find this on the reports, dual enrollment by SEB organizations. All right, with SEB My Account, by now employees should know. If they don't know, I know it's been a long time. Some employees probably haven't logged into SEB My Account since last open enrollment. But again, all they have to do is log in to myaccount.wa or .hca.wa.gov, and then click on the employee subscriber green button, which will direct them to SAW. So I know some of those employees may have forgotten some of their passwords and stuff. So they may be asking you, and we'll talk about that in a minute, how to get them back into their accounts. So what are some things you can do in SEB My Account during open enrollment? So you can enroll or change medical, dental, vision plans. You can waive your SEB medical coverage. You can add or remove dependents. You can also upload documents. You can attest to the spousal premium surcharge. You can access vendor websites to enroll in supplemental coverage, such as life and AD&D. So what are some things they can do year round in SEB My Account? They can view coverage information. They can view their basic employer paid life and AD&D information. They can view LTD insurance information. They can download the statement of insurance, make changes to the tobacco premium surcharge. They can also submit an SOE. So what are some things that employees can't do in SEB My Account? So they can't change their address. They can't make a life insurance change, and they can't enroll in a medical FSA or limited purpose FSA or DCAP. They can't change their HSA contributions. So we ask that your employees print a statement of insurance once after open enrollment. Once they've selected their benefits, they want to go ahead and print this statement of insurance so they have proof that these are the plans that they selected. So SEBB My Account does require the BAs to have managed access. So if you're a benefit administrator and you haven't checked the access management block right there, you might want to do that, because that will allow you to go in and disassociate the subscriber's account. We notice we've had a couple of BAs say, well, I can't see disassociate subscriber's account because you don't have this box checked. And if you check that box, you'll notice the disassociate the subscriber's account will pop up in the lower left corner there. So all you have to do is search for the employee, either by social security number, date of birth, or by name, first name, last name. And then you want to go ahead and verify that that's the employee's identity. You want to check the box next to the employee and then click disassociate the subscriber's account. And this will allow that subscriber to go back in and answer their security questions and to get back into their account. So just an important note that disassociating the subscriber's account does not affect enrollment. It simply releases the login to be reclaimed by the subscriber. Need help with SEBB My Account? You can always call our call center during open enrollment at 855-548-3100 between the hours of 8 and 5 p.m. Monday through Friday. And they're there to help you with your Secure Access Washington, to help you with screen navigation in SEBB My Account, also to upload documents. So for contact information, the employee should contact the BA with questions with eligibility, enrollment, premium surcharge questions, updating their name, address, phone number, adding or removing dependents, getting paper forms. The employee should contact the plans for benefit coverage questions, their ID cards, claims, choosing a doctor or a dentist. They should contact Health Equity for any questions with their UMP high deductible health plan with the health savings account. They should contact MetLife if they have questions about their life insurance and their AD&D insurance. And they should contact Navia Benefit Solutions about questions with their medical or limited purpose FSA or DCAP program. They should contact the standard insurance company with questions about their long-term disability. And then contact Smart Health with questions with your Smart Health program, your account. And then you can also find websites, phone numbers, and mailing addresses on the SEBB Open Enrollment webpage. So as usual, we're going to provide you with some reminders, tips, and resources. So your dependent verification documents are due at the same time as the other required enrollment forms. For a newly eligible employee, they have no later than 31 days of their date of eligibility. And for a person that's submitting a special open enrollment event, they have no later than 60 days of the event date. And then during annual open enrollment, they have until midnight of November 22nd, 2021 to submit those dependent verification documents. So as benefit administrators, you always want to follow up with your employees when their dependent verification documents are not submitted by the employee, or they're invalid or incomplete. So if they submit something and it's incomplete or it's not invalid, then you want to go ahead and call that employee or email them, let them know that you need another document. So when you're submitting FUEs, here's a couple of tips here. Make sure you include your SEBB organization, your signature block, and then you want to complete the full name of the employee, first name, last name, and then their date of birth and the full social security number. Choose the category based on the scenario or question that you're asking. And then please respond within the same FUEs for additional information on the same message. FUEs message gets auto-assigned to our customer service representatives. And then outreach and training, we respond to those FUEs in the orders that we receive them. Please do not respond to a FUEs once it's been resolved, such as thank you, we appreciate. We understand that it just increases our numbers with another message in our FUEs box. Please do not share the following information. Again, that 1-800 number, 700-155 is for benefit administrators only, not for employees to call our customer service number. We are there to assist benefit administrators. And then the PEB division customer service number for retirees and continuation coverage members only, which is 1-800-200-1004. That's only for retirees and those members that are on continuation coverage. And then please do not share the link for the outreach and training fuse or individual email addresses or direct phone numbers with your employees. As a resources, we still have the BA website, the outreach and training 1-800 number, and Fuse, which is a secure messaging system. And we also have the Gov deliveries under notices and updates for BAs. So important websites during open enrollment. You do have the open enrollment website for all the information, resources for your employees to go to. And all the webinars and the schedules are all posted on there. Any plan changes, anything I've talked about is on that website. You do have the open enrollment webinars where it gives you a schedule of all the webinars the carriers will be hosting during open enrollment. And if they're not able to make one of those webinars, they can always watch a recorded presentation by the carrier. And then the virtual benefit fair link right there. That has all the carriers and all the booths for employees to go on the virtual benefit fair. So our next upcoming webinar is October 22nd. And again, this will be hosted by Outreach and Training, but the Navia Benefit Solution employees will be presenting the material. You can register on the Benefit Administrator's webpage under training schedule. And the open enrollment webinars, there's the link right there for medical dental plans, additional benefits. You can find all that on that open enrollment website to include the webinar schedule. Any webinars that we do will be posted on the Benefit Administrator's webpage. And you will find this webinar, if you want to go back through it, it'll be posted under the same webpage under open enrollment. All right.
All right. So I've been busy typing away over here.
I've been busy talking.
Well, thanks. Great job, Rob. One thing I did want to bring up was the new mandatory enrollment in long-term care. That's not something that SEBB administers. That's not something that SEBB is mandating. I don't exactly know what agency or department is making that a mandatory enrollment, but that's not something that SEBB is doing, to my knowledge. Am I correct, Rob?
Yes, you're
Okay.
correct.
So we're not going to be doing any trainings or anything like that. So just wanted to, I saw a few questions and a few likes on those questions. So another question that I had was regarding AFLAC. AFLAC is a supplemental insurance. There are certain plans within AFLAC and other supplemental insurance companies, such as maybe MetLife. There's a few others, but I can't think of them off the top of my head. Districts are able to offer some of these supplemental coverages to their employees, but it's not something that SEBB does training on or SEBB administers. AFLAC is something that the district can bring on their own and have an AFLAC representative or a MetLife representative or whoever come and administer those benefits. And I see here that it looks like long-term care is handled by ESD, so the Employment Security Department. So that's who you would want to reach out if you have questions regarding forms, enrollment, or have any questions regarding this new mandatory enrollment into the long-term care. Thank you for that. All right, so it looks like we have a few minutes. So let me go through a few questions. I've been answering the questions to where everyone can see. So I hope that everyone can kind of see the different answers that I have. I know that can help out everyone. With this new Zoom platform that we switched to recently, it's a little different than what we're used to. So when it comes to the questions and everything is kind of back and forth. So bear with us as we get used to this new Zoom platform.
Yeah, I'm going to try to answer some, but if there's some that we could just answer live, that would be great too, to get them out of the queue here.
All right. So long-term care is administered by ESD, Employment Security Department. And it looks like there's some links that people provided. Thank you so much for that. You are not required to offer AFLAC. No, that is something that the district can offer if they choose, but you are not required to offer it. No.
And I know there's a question, is SEB or Navia sending info to current medical FSA participants to let them know they have an extra 12 months? Well, that isn't for the medical FSA, that's for the DCAP, not for the
Yes.
medical FSA. So I think
Yeah,
someone
that's
was a
one
little
that,
confused.
no, that I already kind of talked to her. That's one that I'm going to
Oh,
follow
okay.
up on because I'm not exactly sure if, I don't know for sure if they're going to be getting, I'm sure they're going to get some sort of communication, but I don't know exactly for sure. So I'm going to follow up with her next week. So there's a question here that if EOI is required at any time for enrollment in LTD, which it's not required during the initial 31-day enrollment window or during this year's annual open enrollment. It's only required after that. But the company that will be processing that EOI, what's the company, Rob? The insurance carrier
For what?
for long-term disability.
Oh, standard.
Standard. So the standard is the one who's going to be processing the EOI. Enrollment forms are submitted to BAs to be processed, but evidence of insurability will, yes, be processed and approved by the standard.
So there's a question here. Will the school district receive copies of the letters being sent from SEB program on slide 104? So those letters are going to the employees. I don't think they're going to be sending letters to the school districts. If an employee is due enrolled, they'll be receiving a letter that they need to take action.
Yes, and then there
Now,
will be that report available in SEBB account that BAs can download to see employees who are affected by dual enrollment, which the number is not going to be as big as I'm sure you're anticipating. It's a very small portion of the SEB population and the PEB population that are affected by dual enrollments from each program.
so I do understand about the LTD and that employees are going to be automatically defaulted. And this was the decision that was done by the board. So I would just, again, advise your employees to go in there and just make sure all their elections are the way that they want them. If they don't go in there at all, like some employees, they don't want to go into Set My Account, they're happy with what they have. Again, remind them that they will be defaulted to pay this premium, and they can decline anytime throughout the year. But initially, come January 1st, they will be charged that premium for employer paid LTD if they don't do anything.
All right, and so here's a question. So AFLAC will not be on the SEB open enrollment as a voluntary benefit. No, AFLAC and any other supplemental insurances such as MetLife, AFLAC, I know the standard has some stuff. That is totally separate from SEB. That is not something that SEB has any part in. SEB just allows districts to bring in those supplemental coverages or insurances to offer to their employees if they would like to. It's not a requirement, but it's not going to be available on like the open enrollment website or the virtual benefit fairs from SEB. Totally separate.
So I think I'm reading, I hope I'm reading this, just jumped on me. Will the employer paid stay in place along with the new employee paid LTD disability? So will they have $100? So the employer paid LTD is not changing. It's the same, the minimum $100, maximum is $400. Will it stay in place? I don't understand. I hope I answered your question on that. The employer paid LTD is not changing. The employee paid LTD is changing, that everybody will be auto enrolled if you're an eligible school employee. And if you do nothing at all, come January 1st, you will be auto enrolled and remain in that 60% coverage plan. You can
And
always
just-
reduce or decline the employer paid coverage anytime throughout the year.
All right, and just a reminder, I am going to be doing an email with the PDF version of today's slides. If you want a copy, you need to send me the email address in the Q&A feature. I don't have access to your email address in Zoom, so I need to know what email address you want it sent to.
Also, keep in mind after this webinar that all participants will receive a follow-up email with a brief survey. We would greatly appreciate your feedback on this.
Yes. And with 1 minute left, there is one thing that I want to point out that I know is mentioned throughout today's webinar. There is going to be 2 recordings that are going to be posted before open enrollment begins. There's going to be one specifically just on the dual enrollment changes and the rule changes, going over examples. It's a much more detailed version of a webinar. So I'm going to be doing a recording on that. And I'm also going to be doing a recording on the new employee paid LTD and all of the details with that. So be on the lookout. We will send out a Gov delivery when those both have posted. They will be recordings. And today's webinar is also being recorded. So you can rewatch this if needed. Should be posted by next week, I would say.
Along with the medical FSA webinar on October 22nd. That'll also be posted too.
Yes. So be sure you're signed up for Gov delivery. That's where you're going to receive all of the notices, updates when it comes to OE, our recordings being posted, all of that good stuff. With that being said, it is 11:30. So we're going to go ahead and wrap up today's webinar. There are a lot of questions that have gone unanswered. I do apologize for that. It looks like within the last couple of minutes, a ton came in. So we're going to work through those the rest of today and early next week, and we will get back to you with responses early next week. And with that being said, we want to thank you for attending today's webinar. Happy Friday. I hope you got a lot of great information out of today. I hope you have a great weekend and a good rest of your day.
Yeah, and have a great weekend. And again, that SEBB My Account